Hi, my name is Dr. Nathan Coles. I practice chiropractic at Axelson Chiropractic. You may be hearing a baby in the background. Today we're going to be talking to Jesse Parrotti, owner of One Stop Music Shop here in Bayboro, North Carolina. Jesse was one of our patients, and he'd come in just for regularly associated chiropractic complaints, neck pain, back pain, things such as that. When he came in after the birth of his daughter, he mentioned that she had failed 3 hearing tests.
I go to the chiropractor, Nathan Coles, and I mentioned something to him about my baby's hearing loss. And he said he'd be willing to do some chiropractic work on her to see if that would help.
Now, chiropractic is well known for its ability to help people in the musculoskeletal areas such as neck pain, back pain, disc-related issues, pain down the arms, legs, numbness, tingling, headaches, things such as that. But it's lesser known that these same nerve roots that exit the spinal cord also innervate different areas of the body, of course motor function, sensory function, and organ function. But all the way at the top of the spine, where we're going to be talking about today, is the brainstem that drops down through the top couple of vertebrae, and that's a very, very important area to maintain stability in. Generally with babies, it's going to be an upper cervical, the top couple of vertebrae, C1, C2, where that brainstem drops through the medulla oblongata, and you have all those a great amount of nervous tissue in that area. So, and especially with the birth trauma, there's a lot of twisting, a lot of yanking, a lot of pulling, and this tiny baby's supple little neck. And that's definitely the first spot you want to go. And that's the first spot we went to on Hannah, where we felt something on her left side was just restricted and not moving. It was just a little bit rotated. Now, when adjusting an infant, it doesn't take a whole lot of pressure at all. Infants are very supple and easy to adjust. We don't adjust them in the same fashion as we would an adult. Both gentle, but much, much less forces need to be applied. If someone has a hearing abnormality in the younger years, they can start to develop language or speech type of problems as well. So it's important in many different aspects, especially for Jesse with the kind of field that he's in and what's important to him and his family.
We did 2 visits with Dr. Coles, and then we took her to her hearing exam in Greenville. She passed the test with flying colors in Greenville. The doctor there said it's not very often that he gets to give parents good news, but we sure received some that day. So. After
I had adjusted Hannah, I went to the literature to see if there had been any precedent to this type of correction of hearing loss through chiropractic manipulation. Of course, there's the very first adjustment given to Harvey Lillard in 1895 that restored the patient's hearing. But more recently, there was a 36-year-old soccer player who headed a soccer ball and suffered some hearing loss. And after that, he received some chiropractic care, and his hearing loss is actually able to be restored because of upper cervical subluxations or minor misalignments. It's increasingly popular for parents to take their infants to the chiropractor right after birth to correct some of that birth trauma that occurs, because a lot of times babies will become colicky. Chiropractors can treat ear infections or help prevent ear infections. I'm the father of 4 small children, so I see the importance of taking care of the musculoskeletal system early in life during the formative years. It's a very unique situation as well, because of course Hannah's dad owns a music store and teaches music lessons, and so for her to be able to experience that in both ears without any problems or issues, because obviously she's going to want to get involved in that later in life.
Well, you did good job. Huh.